So the other consultation model that I want to talk about is something called Helmans Folk model. Now, Hellman was a doctor who wrote books about his experiences in medicine, and he became famous for writing what became known as Helmans Folk model, where he described the things that he felt patients wanted to know by the end of the consultation. I've shrunk this down to 4 things for sort of ease of this video. So those 4 things are: patients want to know what's wrong with them, what's the diagnosis. They want to know what is the cause, why did it happen, and in particular, was it something they had done. Number 3, they want to know what the treatments options are. And number 4, they want to know what would happen if they did nothing, as in what's the natural history of the disease. The reason I like this is, in particular, doctors often don't think about describing the natural history, and they don't describe why this condition occurred some of the time. So first one, why is this happen? What's the diagnosis? Is almost always something we talk about, but I have seen trainee videos where the diagnosis isn't certain. Maybe there's been lots of different symptoms that they can't really piece together, or the symptoms seem a bit odd. Often that diagnosis moment is skipped onto the investigations, what they're going to do to try and look for a cause. Try never to do that. Always try to give some kind of description, some kind of differential diagnosis. These are the things it could be, or these symptoms fit with this, these symptoms fit with this. The other thing you could do, if you don't really feel like you can pin a name to it, then at least describe the pathology of what's going on. Start trying to reduce the mystery and the fear that might be going on inside the patient's mind by describing the pathology. So, for example, tingling down an arm. You might not know exactly what it is, but you can say the tingling describing, that burning sensation, is definitely a nerve being affected, maybe being trapped. I'm just not sure where it's being trapped. So, and you might expand on that. Abdominal symptoms, you might think the list is just too big of these vague symptoms, but if the person's got cramping and bloating, you can be quite positive in saying that cramping is your bowels pushing harder and the bloating is wind building up in the bowels. So I'm not sure what's going on, we're going to test further for that, but I'm very sure it's coming from your bowels. So you can always describe pathology. Where the bit that often gets missed is this, what's the reason for it? And particular patients often want to know, is there something I did? They want to know if they were to blame for it. They also want to know, is it something they can avoid in the future? So when you're thinking about the pathology, don't just think, Eureka, I found the diagnosis. Try and think about why it might have happened and link that back. So when you're talking about ICE, the ideas, patients, when you're looking for what do you think the diagnosis might be, patients are often thinking, what do they think has caused it? That's often the idea they're thinking of. So think of the idea as 2 separate bits and try and look for both if you can, and then build that thought into the management plan. Treatment options, almost every consultation will describe treatment options, but a patient can't be fully informed about their decision to decide to go with the treatment or not unless they know what would happen if it didn't get used. So that's the natural history, and that often gets missed. That natural history, what do you think is going to happen next? There are times when it is used and it's really, really important. So for example, minor illnesses, you'd want to describe the natural history. What's going to happen next with this illness? Firstly, to reassure patients maybe about why they don't need the antibiotics, but also to be able to then say, okay, this is the point where it should have got better or should have changed in some way. It hasn't, so this is the point I need to start those antibiotics or I need to contact again. So it's always needed to be able for a person to be fully informed about taking up a treatment option, and it's really important if there's any form of safety net, because the patient needs to know what they would expect to happen to then build into the things that are abnormal. I hope that makes sense, and I will be talking about ICE questions and discussing management plans in future videos. Thanks.